Can your body regenerate bone naturally without the need of bone grafting materials? Most dentists believe that we need to do a bone graft every time a tooth is extracted. Most will tell you that a graft is necessary to build new bone when it's missing, or that you need a bone substitute like bovine bone to fill the gap, to fill the space after a tooth has been extracted. But what they don't tell you is that your body has the potential to regenerate and build new bone naturally. Hi, I'm Dr. Fernando Verdugo, American board certified periodontist since 2003, clinician, researcher, and published author. With over 25 years of experience in bone regeneration and implant dentistry, helping thousands of patients achieve stable and aesthetic outcomes in a more natural way. Today I'm going to show you how we can achieve this and why this method is changing the paradigm in implant dentistry. After a tooth has been extracted, the process of bone remodeling begins. The alveolar bony housing starts losing its volume as a result of the missing tooth. Each individual is different, of course, and some may have different susceptibility and bone healing properties. So we may see more or less bone shrinkage, volume loss as a result of tooth extraction. Regardless of these individual differences, most professionals choose to graft the socket with the bone substitute to prevent volume loss. The problem is that these bone substitutes are not always well tolerated or well incorporated with the patient's own native bone. Many patients simply don't feel comfortable having them just because they don't belong to their body, they are not their own tissue. The periosteal membrane, which is the membrane that is sitting right next to the socket where that tooth has been extracted, has a tremendous potential for bone regeneration and repair. This natural membrane has skeletal progenitor cells, stem cells, osteoblasts, pericytes, blood vessels, and basically the right cocktail of ingredients to boost and induce new bone formation and regeneration. The periosteal membrane is a central mediator in bone regeneration and delivers 70 to 80% of the blood supply to the surface of the cortical bone by proximity. You can enhance periosteal-guided bone regeneration by preserving its integrity after tooth extraction and by thoroughly cleaning out that socket with a sterile saline solution, removing any traces of granulation tissue. By the end of our procedure, we want to see a socket, a healthy socket that is filled with the osseous coagulum, which will produce new bone formation in a short period of time. What are the benefits of periosteal-guided bone regeneration after a tooth has been extracted? It is a biocompatible, more natural approach that provides a stable, long-lasting clinical outcome. This patient needed an extraction of the hopeless tooth with severe bone loss. The tooth was infected and had severe bone loss both on the buccal aspect as well as on the palatal. After extracting the hopeless tooth, a thorough decontamination and clean out of the site was done, making that socket bleed using sterile saline solution and completely eliminating any traces of infected granulation tissue that could jeopardize the formation of new bone. No bone grafting materials or membranes were used to regenerate this site with severe bone loss. In about 8 weeks, that socket had full repair and bone fill that was confirmed by a CT scan. Bottom line, bone regeneration intra-socket does not need to depend necessarily on bone grafting materials or membranes. The more severe is the bone loss, the less chances of that socket to repair and have bone fill if we use a bone substitute. Basically, your body has the potential to regenerate and stimulate new bone formation in a short period of time if we know how to guide it. If you want to learn more about your body's natural way to build new bone and advanced implant surgery, subscribe and follow me in my channel. These are all different clinical scenarios where after the teeth had been extracted, they all presented with severe bone loss, especially at the buccal aspect, severe facial dehiscences. No grafting of any type was done, and a CT scan was taken at about 12 weeks post-extraction. The CT scan data confirmed the bone repair and the new formation of a buccal bone, regardless of the bone dehiscence present in the buccal aspect and regardless of not performing any bone grafting of any type. Our CBCT data has confirmed the formation of a new buccal bone on those sites that presented severe bone loss on the facial aspect. So new bone formation is possible regardless of the presence of buccal bone dehiscences. And we have published this data on Archives of Oral Biology in a group of over 90 patients. This data confirms the tremendous potential of bone repair of our body in sites that present severe buccal bone dehiscences. Of course, always remember that each patient is different. There is different healing potentials. And so we need to understand when we can achieve this bone regeneration on sites that present severe bone loss.